Welcome to the Peak Performance Podcast, your guide to optimizing your life one health tip at a time. This podcast is designed to entertain and inform, not to provide medical or health advice. Always consult your doctor when it comes to your personal health or before you make any changes to your diet, exercise, or lifestyle.
Ladies and gentlemen, welcome to the Peak Performance Podcast. I'm Coach Kyle.
And I'm Dr. K. Thank you for joining us as we discuss less common applications of stem cell and regenerative products that you may not have heard of.
Very exciting. So, less common applications. So, where do you want to start here, Dr. K?
Well, let me outline that there's going to be three main things I want to cover. One is intranasal.
Okay.
Not even three. There's going to be more. There's intranasal, there's ciliary ganglion, there's phenylpalatine ganglion, there's cosmetic, and then there's IV. And some of these can be done with other products besides stem cells, and we'll talk about that as well. So which one of those piqued your interest the most?
Well, let's go with one of the two words I actually understood, which is either IV or intranasal. But intranasal does seem the most interesting.
Yeah, absolutely. So intranasal, and then the other ones that, I said a bunch of fancy words people don't know about. So we'll cover all those together. And this is specifically exosomes. They're the only thing small enough to do this. But inside of your nose, some of you may know this, some of you may not. There's something called a danger triangle on your face. It's, you're not supposed to pop pimples in this area because there's a blood vessel that connects directly to your brain. And if you pop a pimple on that area, get infected and cause a brain infection, then you die. Fun side fact.
Wow. Not either.
Yeah, I mean, maybe I learned this in medical school. I thought it was common knowledge. My parents always yelled at me about it.
We should do a reel about it. Teach people.
Maybe, actually. But we can utilize that same blood vessel group. And so the pterygoid starts with a P if you want to look it up, but pterygoid blood vessels, and you can access it if you inject. It's not like this. It doesn't go all the way up the nose. It goes basically straight back. And it's a small needle. Honestly, I don't think it hurts that much, but it's a needle that goes straight back, and you inject some exosomes, and they'll follow that blood vessel right into the brain. And they've done radioisotope studies, so they tag the exosomes with radiograph material so they can track it with x-rays. And they will actually see that they will track straight into the brain quite quickly, actually.
Wow, that's impressive. So why do we do this? Why do we care about that?
Yeah, so as with all things stem cell, we can't promise or guarantee any kinds of treatments. So these are all hypotheticals that they could be used for. Let me put that disclaimer on there. But basically any kind of brain injury, it can help with things like one true anoxic brain injury, which anoxic means no oxygen. Could be things like traumatic brain injuries, could be post-strokes, could be cognitive issues such as dementia, Alzheimer's, stuff like that. Basically anything that upsets the white matter of the brain, we can put the exosomes in, and they can attempt to heal the white matter of the brain.
So would this do anything for, like, say, a biohacker that just wants to be sharper? Or is this really like a more of a medical intervention? And if you wanted to just be sharper, take some oral nicotine?
Yes. So no, this can absolutely improve your cognitive function at a baseline. Just makes you feel sharper, because everyone, as you age, you do lose parts of your brain. It just happens. Your brain shrinks as you age. So if you can restore some of that function with the intranasal exosomes, you'll almost certainly notice it.
Very cool. So, tell me about this procedure. You said it was a needle. So, is there numbing? Like, how long does it take? Like, is this a very simple thing?
Oh, this is one of the simplest things I do. So numbing is honestly kind of optional. When I first started doing these, we used to do cotton soaked lidocaine. They'd hold your nose for 15 minutes. People would hate those because lidocaine always drips down your throat and your mouth, and you get a numb mouth and numb throat. And then I would take lidocaine injections and inject. And then I would do the exosome injections and inject. Basically, I've stopped doing all of that, and now I just do the exosome injections. Because people always hated, like I said, the cotton soaked lidocaine because then you have a numb lips and it tastes disgusting and all that. And then I realized if I'm going to inject you, once to numb you and then once to inject the product, either way you're feeling one injection. So why don't I just do the exosomes and get it over with?
That makes a lot of sense.
So the procedure, we do it right in the office. It takes me literally 5 seconds per side. We always do both sides of the nose. Whatever dose you're doing, we split it just to help track along the blood vessels. Because you can only put so much volume into that space because the skin there is thin.
Very neat. Yeah, that sounds cool. And I know, like, you can do, like, you could take this further and do, like, find a neurosurgeon who will do stem cell injections, like, in your spinal cord and brain.
Mm-hmm.
But this is, like, a very, like, difficult, risky, and expensive procedure. So this would be something you would want to try before going that route.
Oh, absolutely. Because with this, your biggest downside is that it doesn't work and you're out the money you spent. There's almost no risk. I can't say there's zero risk, but there's almost no risk. Basically, your only risk with this is a very small risk of infection just because needles entering through the skin.
That makes sense. So, talk about cost. This is not a thing I've seen, like, done a lot. So I'm very in these markets, and not a whole lot of people do these, as I've heard. So you have to find a provider first.
Correct. So one of the guys that really made this popular, his name is Dr. A.J. Farshin. He used to run the American Academy of Stem Cell Physicians before he passed on to other people. I learned it directly from him. That seems to be the way that most people that do it in this country, and there's honestly not that many that do it well. Because you do have to make sure you are there's a particular point there called turbinate. If you're not on the turbinate, you're just dropping it randomly in the nose, it's not going to work. So you want to make sure you learn it from someone who's really good at it. There's not too many people doing it. Cost, it varies, honestly. So the biggest difference is volume. Because the company that we use for exosomes, you could buy either 1cc or 5cc vials. Some people would just buy the 1cc vial and stick it up their nose. Some people buy the 5cc, and I'll let people do up to half of that in the nose, and they'll do the other half somewhere else. And that's what we're going to talk about further in the episode. So cost, it depends what people are charging for exosomes. The company we use is 3 billion, whatever exosomes per milliliter. You can get 1 billion products, you get 100 millions products. So kind of just price varies so much. Thousands to 10,000s, kind of the window.
Yeah. So it's a big window. Basically depends on how many exosomes you're getting. Again, like you mentioned on our regenerative episode, the skill and experience of the doctor doing it. Basically, if you're doing it with anything else or buying in bulk and that kind of thing.
Yep, exactly.
Okay. So anything else you want to cover on intranasal before we move onward?
No, that's pretty much it.
Okay. So I think you said stellar ganglion.
Ciliary ganglion. Ciliary ganglion is behind your eye. It's like the way the injections go, you go right there. No. It's okay. We don't go through the eye. We don't touch the eye. We go just under the eyelid.
I'm like, needles don't bother me at all, except anything getting close to my eyes, I freak out. Like,
okay, don't freak people out because then they won't do it.
Yeah, it's just a me thing.
It's a Coach Kyle thing. Just move on. So yeah, ciliary ganglion. So we use this. So there have been doctors that have injected patients directly in the eye with stem cells, and there were some not so good results. You can Google this. There was lawsuits. I'll leave it at that. What we do is quite a bit safer. It's not as 100% good as doing that. But basically, the idea is that we bathe this nerve in exosome products. You could do other growth factor products as well. I prefer exosomes for it. But you bathe the ciliary ganglion in the exosomes, and the idea is that it helps stimulate the nerve, and hopefully some of it actually tracks into the eye. And the idea behind this is that we're trying to treat, basically eye issues, things like macular degeneration, scarring, anything like that. You can't fix vision issues with this. I can't promise you that. If you did get vision improvement, that'd be very cool, but that's not something that I say that you could get. The coolest thing, I had a patient, this was actually a few weeks ago. He had uveitis when he was younger, and it caused scarring of his eye. So there was a particular plane of his eye they just couldn't see through. We did the exosomes, and I called him, a few weeks later, and he goes, even on my drive home, I was noticing that my vision has improved.
Nice.
That was very cool. So, intranasal, actually, I forgot to mention this. Intranasal, ciliary, all these alternative uses, besides cosmetics, sometimes people see results within minutes. Sometimes people take 30 to 90 days. It kind of varies on the person, the condition going on. So that's kind of the window of improvement.
That makes sense. In terms of stacking for this injection of the eye nerve,
Yep.
I think a good stack for this would be a product like Blue Eyes from Mitozen. They're eye drops with methylene blue and a few other things in it, which can turbocharge your mitochondria. So if you pump the growth factors in there and then you give the mitochondria the energy, it could probably be a more synergistic effect.
That's a very cool idea. I didn't even know they made an eyedropper.
Yeah, they're brand new. They just came out a few months ago. So it's pretty neat stuff. They've, they can't claim it, but I talked to the maker of it and they have seen vision improvements.
Wow. Like for people like me that need glasses too far away.
Yep.
I'm about to order some right now.
The only downside is it burns.
Yeah, I can imagine methylene blue in your eyes burns.
Yeah.
Maybe not.
It's called Blue Eyes.
Really? Have you tried it?
I have not tried it because I'm a freak about eyes. So that's where my biohacking line is drawn. Like, we're doing rectal suppositories, I'm in. But eye stuff, no.
Yeah, blue eyes and burning, I may not be ordering some. That's too much for me.
But, if someone's investing in exosomes for this procedure, a $40 thing of eye drops with methylene blue in it might just be a good
absolutely. Stack. The other thing, I don't know if you could still get these, but BPC eye drops are also helpful. I would do that for macular degeneration more so, just to help promote blood flow and blood vessels growing to the area.
Nice. Yeah, that's cool. So next stop, where are we headed?
Let me cover this one as well. This is for tinnitus. This is a new one. I have not done any myself. The doctor who taught me them, Dr. Farsh, he taught me how to do them. I haven't done any, patients of my own with this yet. But for tinnitus, he is saying he's done 5 people. Last I talked to him, he's saying that I think he said either all 5 or 4 of them got noticeable improvement in their tinnitus. I'm still leaving it as a 50. If someone asks me about it, and I think that's why no one wants to do it, it's a 50% chance of it working. I think that's a very safe bet. 50% chance it helps you, 50% chance it does nothing for your tinnitus. But you inject it, it's right around here. You inject, and cranial nerve, I think it's 8, has the controls your hearing. So we're just trying to bathe that nerve in exosome product and see if we get that nerve to help heal a little bit.
This would probably be another good one, though, if you haven't chelated for mercury, to probably chelate for mercury before you try to do this injection, because that might resolve or improve your tinnitus.
I get patients with tinnitus. I cannot get tinnitus better. It's so hard. I truly have a 50% success rate on it, which is quite low for everything I do.
Yeah. I think it's, from what I've seen, I think it has to do with the ALA cycles are the best way to hit it, because it's a brain-related heavy metal symptom.
Interesting.
So I don't think DMPS will quite hit it, which is kind of sad. So, and you just have to go through the forever that it takes to detox with ALA after you get your DMPS. And if you want to hear more about heavy metal detox, go to our episode on that.
Yep.
We'll link it in the show notes.
Yeah. Okay. So that covers nose, eyes, and ears. What's left?
What's left? Your face?
Face. Actually, mouth.
Mouth.
There's all sorts of random places that you could put exosomes. So I have done this only a few times. Gum recession. You can inject, and I tend to do ozone more for this, but you can use exosomes, or even better is amniotic tissue. But if you're having severe gum recession, we numb you first. I numb you like the dentist does. Your whole mouth is numb. But I inject regenerative products along the gum lines, and I've actually seen it improve the gum recession to the point that one of my patients, for example, dentist was telling him he needed new crowns because his gum recession was getting so bad that there was too much of a gap. But he said, I don't want to pay like $5,000 for new crowns. Let's try this. So we ended up injecting all along the gums and all the recessive areas. And about 3 months later, he goes back to dentist, and dentist's like, you don't need new crowns anymore. What did you do? We did 1 round of regenerative product and then a whole lot of rounds of ozone.
That's pretty cool. That's very neat. So, I mean, is that a very common problem, gum recession?
I feel like it's becoming more and more common because everyone's grinding their teeth, and that creates the inflammation plus the diet.
That makes sense. Yeah. I had the opposite problem.
Too
I
much
had
gum?
too much gum overgrowth. Yeah. I was years ago, back when I was in like high school. The orthodontist was telling me that if they grew any more, they were going to have to do surgery and literally cut them out. I was like, oh, no.
Ugh. I feel like you either mentioned that on a podcast or you've told me that before. I can't remember which.
Yeah, probably. That was, I was like, let's not do that. And he was like, well, your second answer is just brush them really hard, kind of beat them down.
Is that what you did?
Yeah, it worked.
Okay.
So, but brushing it really hard is not going to regrow anything. That's for sure.
No, that'll actually lead to decline again.
Yeah. Yeah.
Okay, so now we've covered eyes, ears, mouth, nose. Do you want to talk about IV or cosmetic next?
Ooh. Well, I mean, we're on the face. Like, let's just roll on the cosmetic.
Yeah. So cosmetic, and this one people have probably heard more of. So this is a trademark term. The company I work for, the Osteopathic Center, I believe does license the trademark from the Dr. Charles Runel. Vampire Facelift.
Mm-hmm.
Vampire Facelift, Vampire Breast Lift, P-Shot, O-Shot. Those are all the shots that you could do. And you could do this. The original was PRP. That's why it's called a vampire, because it's your blood that you're putting back in your face. But you can do this with PRP. You could do it with bone marrow. You could do it with adipose. You could do it with amniotic. You could do it with exosomes. You could do it with umbilical. So basically any regenerative product besides prolotherapy, you could do these things with. So the idea behind, so you could do face, you could do chest, you could do neck, you could do back of the hands, you could do pretty much anywhere. The idea is that you're doing a combination of microneedling with regenerative product and injection with regenerative product. Here's the difference between them. You microneedle to resurface the skin, so things like sun damage, fine wrinkles, scars, we microneedle. Deep things like deep scars, like acne scars or cutting scars, and then deep wrinkles, you inject. And the idea behind it is to improve blood flow, restore collagen, improve plumpness, improve turgor of the skin in all those areas.
Plumpness. Let's get more plump.
That's right. Well, that's the sign of youth, which is the whole point of these, trying to reverse. So you can do it in all those places. And then the vampire breast lift, there are ligaments. There's breast lift and facelift. So there's ligaments for both of them. So for women, breast lift, or along the face for facelift, you're injecting those ligaments with the idea to retighten them, to pull that skin up. All this stuff, it is unfortunately temporary-ish. 1 to 3 years is kind of the window that it lasts for, just depending on which product you use and how well you take care of yourself afterwards. So what I do is I recommend about once a year, you just do touch-ups to kind of stay on top of it. Makes it easier than having to go through. We do 3 rounds of injections in the beginning. So if you do 1 round a year afterwards, it's better than doing 3 rounds again and again and again every few years when it wears off.
Yeah, and that's for wrinkles. The scars, once you get rid of them, shouldn't they like stay gone for a while?
Scars, yes. This is more for like the facelift, wrinkles, stuff like that.
So I don't know if you can see it, but I went through this bulking phase. Yeah, you probably can't see it, but I have like stretch marks, like on my bicep and shoulder from like gaining too much muscle too quick.
Yep.
Is this something you could treat?
Stretch marks aren't. I don't know what actually causes stretch marks. I'm not 100%, but I wouldn't say that I could treat those.
Okay. Well, maybe we'll try it next time I'm down, just for the heck of it. I'll be your N of 1.
Sure. I mean, you have been for so many things. Why not one more?
Yeah, we'll see. See, I'm finally getting to the point in my process where, like, you know, my back and neck aren't killing me, and I don't have a ton of toxins. So now I can start getting into these like finer things, a little more vain.
Right. He starts having fun with it. That's all my patients' goal is there, because they see every day. You know, they pass by the menus for all the cosmetic stuff in my office. They're like, you know, once I'm done chelating, once I'm done this, I'm going to treat myself and do some cosmetic stuff. Like, that's a good plan.
Yeah, and a lot of times you just look better because you got the toxins out.
That's also a big thing. So we were talking about all these other purposes. So that's pretty much all the cosmetic. So now we've covered skin, eyes, ears, nose, mouth. Really, the other big thing I want to cover is IV.
IV stem cells.
IV, yes, stem cells.
So I've heard this talked by like a lot of people in the biohacking movement, and like Tony Robbins is a big like advocate of this.
Yep.
So what are the reasons? Why would you do an IV stem cell?
So when we inject stem cells, we're trying to treat musculoskeletal issues. When we do all the things that we just talked about, we're trying to treat particular issues. When we do them IV, now we're driving them towards basically an undetermined goal. And the reason for that is when you do them IV, now your body gets to pick where it puts them. And it can put them truly anywhere. So let me lead into this with a story. This was years ago. We had a pro NFL player, and he tore his Achilles in the game. And he had the surgery, and a while later he started rejecting the stitches. And so he has a second surgery to take out the rejected stitch, sew him back up, and send him on his way. A while later, he starts rejecting the second stitch. So his PT calls us and says, hey, this guy keeps rejecting his stitches. He was a big-time player. And if he keeps rejecting, he's going to have, he's not going to be able to play the next season because we're running out of time to get him better. So the guy calls us and he's like, hey, what can you do? So we said, we're going to do a lot of IV ozone and IV stem cells on you. And when you do IV stem cells, normally you feel them. You feel kind of drunk or jittery or good or one of those things, and you're just feeling really elated. And for him, no matter how fast I pushed them, he just wouldn't feel anything, nothing, which is very odd. And I kept asking him, do you feel anything? Do you feel anything? No. Am I supposed to? I'm like, you should. But then we did 3 or 4 rounds of them. And then like 6 weeks later, he stopped rejecting the stitches. His body was driving the exosome so directly at his Achilles that he just wasn't feeling it anywhere else. So
yeah, so the body will use it for the purposes that it needs.
Correct. So I get patients all the time. They're like, I would do IV stem cells to fix my neuropathy or fix my heart or fix my liver or whatever. I'm like, we can do it. I can't promise you that that is what they will fix. For example, I have a patient. She didn't do the IV stem cells with me. She did them with someone else before she met me. But then she was telling me the story. She goes, I used to have really bad neuropathy, and I had bad fatigue and all these other things. I wanted to do the IV stem cells because that doctor told me they'll solve all my problems and make me feel better. And when I did them, the neuropathy went away, but nothing else changed. And so that I always warn my patients, IV stem cells are the most unguaranteed thing that you do. We have no idea where they're going to go. But they're going to go to where your body feels is the most important place to put them.
Yeah. So biohackers use these IV stem cells a lot for just like anti-aging.
Yep.
Just basically, not treating specific things, because usually biohackers or people who are like targeting specific improvements will do it with a more targeted intervention.
Yep.
But like for IV stem cells, it's just like, hey, I just kind of want to like make sure everything's running tip-top shape.
Yeah. And so if you're really healthy and you're doing these, then you're getting just massive benefits out of them. Whereas if you're sick and you do these, then they're going to get driven towards something. But one of the primary things that they do for pretty much everyone is they can reverse senescence. Do you know what that is?
Senescence. Yeah, that's like dead cells or zombie cells floating around.
Yeah, basically zombie cells. They're cells that turn off when telomeres get too short, and then they just kind of, they exist, they cause inflammation and all sorts of problems. When you do the IV stem cells, your body can actually turn on those senescent cells for a little bit, just so your body can actually clear them out.
Oh, nice. There's also very good supplements that do that. Probably not as effectively as stem cells, but Qualia Senolytic is kind of a shotgun formula that has a lot of things that have been shown and proven to kill the zombie cells.
I like how you had no idea I was going to say they could reverse senescence, and you just happen to have that handy.
I just happen to have it on my desk right here.
Good.
We're ready to go.
Yeah, he's predicting everything I could do today. Okay, but yeah, so IV stem cells, that's kind of the purpose of them. So yes, there are performance benefits out of them. They make you feel better. Actually, this is another interesting one. I have a patient. He's done them a few times in his life. Now, a few times with me, a few times with someone else. And this is actually something else I want to point out. So the very first time he did them IV, and he's always had trouble gaining weight, putting on muscle. He said he put on quite a few pounds when he did it the first time. I don't want to say the number because I don't remember, and he may be watching this. But he put on quite a few pounds the first time he did it. And then he flatlined again. And then he did them, actually, he saw a doctor, and I'm not sure if it was a chiropractor or an MD or DR, whatever they were, but they told him that he could have the, I think it was exosomes, injected into, they gave him 4 injections, 2 in the butt, 2 in the arms. And they're like, oh, it's the same as IV, you'll get the same benefits. And he did not get the same benefits. He felt a little bit better, but not crazy good. And then he found me, became friends. He did exosomes IV again. He goes, yeah, this feels similar to how I did them the first time IV. I feel really wired, and I just don't feel that with the injections. So that's a caveat. IV is not the same as just injecting them intramuscularly. It's nowhere near the same effects. But then, too, he gained muscle mass every time he does the IV exosomes.
Interesting.
It's not as drastic as the first time, but he does it every time.
So that's probably something like some kind of system in terms of his musculoskeletal system needed regulation.
Yep.
And the growth factors and the stem cells basically just kind of reset that to some degree.
Yep, exactly.
And when you inject intramuscularly, it's not nearly like a systemic effect, but like it could be really good, like if you tore your bicep.
Yeah, and so see our episode about musculoskeletal injections, because that's what we do them for. But if I inject you in the deltoid with exosomes and you have a small tear in your deltoid, they're just going to stay right there and fix your deltoid. They're not going to travel anywhere because your body says, okay, you stuck them here. We're going to use them in the first available resource.
Yeah. So it's important, folks, to find a doctor who will use the right treatment to get at the symptom or thing you want to improve. So whether it's systemic improvement or generalized improvement or specific targeted improvement, like use the right tactic to approach it.
Yes, that's exactly it.
Cool. So is there anything else about strange uses of stem cells that we haven't heard of before?
The last thing I mentioned was P-shot and O-shot. These are also trademarked by that same guy that trademarked Vampire Facelift. P-shots for guys, O-shots for girls. P, penis shot, Priapus shot, I think it actually stands for. But basically, it's to help with erectile dysfunction. It just improves blood flow. Can be done with any regenerative product. Basically, for people suffering with erectile dysfunction, it is a good source. Does not make it bigger. Just helps ED.
So to actually talk to that point, there was a study that came out, and it was called, I'm not even joking, the P-long study. And what they did was they did PRP injections in the penis, along with pumping with a penis pump. And they did show a average increase. I think it was like 0.75 of an inch in length and a half of an inch in girth.
That's actually pretty good.
If you do PRP, I'm not sure if it works with stem cells. I don't know because that wasn't in the study. But if you do PRP and you want growth from it, consider stacking it with pumping and or something like Gainswave to open up new blood cells.
Yeah. So the other thing you can do these injections for is Peyronie's disease, which is basically thickening and scarring of the skin. And so Shockwave is super effective there in combination with PRP.
There you go.
And then O-shot is for women. Can treat all sorts of vaginal issues, atrophy, dryness, decreased stimulation. I don't remember if it helps with bladder control issues. I don't want to say yes. I don't want to say no. I've called my office if you want to find out, and I will search that one after we're done with this podcast.
Yeah. I've heard of people doing like stem cells, like in the vagina, like post childbirth, like for repair and stuff like that.
Yes, that's absolutely, because you're repairing the vaginal walls. That's absolutely a benefit for it.
Okay. So that would probably be, in my opinion, one of the best use cases for it, because you're going to see the most immediate healing, and then all kinds of other disorders after that.
Yep. Yeah,
so that's something people don't talk about. It's something people don't talk about a lot, but I think it could be very important for a lot of people struggling with issues that they don't want to talk about.
Yep. Yeah, so I mean, a lot of sexual issues, the O-shot actually does help quite well with.
Very nice. Okay. You got any more for me? You've just been like piling knowledge on me today.
No, that's all I've got for alternative uses of regenerative products and stem cells.
Yeah. And you've heard it here, folks. Dr. K has not injected my penis yet, but maybe he will in the future.
You're paying double. No, I'm kidding.
He's like, to put up with you, I need double. Oh my goodness. Okay, well, thanks for joining us, folks. This is the Peak Performance Podcast. I'm Coach Kyle.
And I'm Dr. K. Thank you for joining us, and we'll see you next time.
Adios.
Thanks for tuning in to another episode of the Peak Performance Podcast, your #1 resource for today's top health hacks and facts. You can follow us on Instagram at the Peak Performance Pod or on X at Peak Perform Pod. You can also check out our website and weekly blogs at peakperformancepodcast.online. Again, thanks for watching, and don't forget to subscribe. We put out a new podcast every Thursday. The content of this podcast is provided for informational purposes only and is not intended for the purposes of diagnosing, treating, curing, or preventing any disease. Before using any products referenced on the podcast, consult with your healthcare provider, carefully read all labels, and heed all directions and cautions that accompany the product. Information found or received through the podcast should not be used in place of a consultation or advice from a healthcare provider. If you suspect you have a medical problem or should you have any healthcare questions, please promptly call or see your healthcare provider. This podcast, including Coach Kyle, Dr. K, and producers, disclaim responsibility for any possible adverse effects from the use of the information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. This podcast may contain paid endorsements and advertisements for products or services. Individuals on this podcast may have a direct or indirect financial interest in products or services referred to herein.